All right. So thanks again. So I'm going to present for you all a very high level overview. This is a presentation we like to call Navigating the Pandemic Maze. I am going to try to talk slowly because I understand that I am being interpreted into Spanish. So I will try my best to keep the presentation as slow as possible. But I am going to talk about the latest in COVID-19 testing and treatment. Particularly, I am going to focus a lot on the resources that remain available for under and uninsured people throughout the state of North Carolina. We understand that health equity is a shared responsibility. And so we want to stay true to our commitment in making sure that treatment, testing, evaluation, and vaccine are accessible for all individuals in North Carolina. So my objectives that I will cover over the next few minutes are to identify and explain available resources and assistance programs for under and uninsured patients seeking COVID-19 testing, evaluation, and treatment. And then I will round out the presentation talking about the commercialization of COVID-19 drugs and that impact and the impact on patient access to them. So we'll first start talking about resources for under and uninsured people. I want to highlight that the North Carolina Department of Health and Human Services COVID-19 website will always be, for North Carolinians, the best location to go to find out what is available for free in the community. So if you go to our testing website, I do have a link here on this page. These slides have been shared out so they can be shared with you as well. You can go and find out where you can pick up free at-home tests. Now, I don't know about you, but if you've been into a retail drugstore lately, you may have seen COVID-19 test kits are available, but the most inexpensive pack of tests I have seen is $19.99. So we still have quite a few, a couple 100,000 free COVID-19 tests that are available at community access points. Participants only need to be 14 years of age to pick up those free tests. We encourage anyone who is going to be gathering for the holidays to go ahead and pick up your test now. We no longer have any tests available in the state warehouse. So we have distributed all of the tests to a sum total of 14.5 million tests have been distributed since 2020, since we began distributing tests. So all of our tests are distributed now to community access points that you can find on the website. You can just put in a zip code. If you can see my cursor, you'll put a zip code here into the map and it will present all of the locations and their hours that they are available for someone to pick up free COVID-19 test kits. Now, if someone is not able to go to a community access point, you are still able to get free tests delivered to all households in the US from the federal government. They opened this ordering for tests in September for people to order up to 4 tests per household. However, they reopened the window of ordering again, such that if you have not ordered your 4 tests, you can now order up to 8 tests per household. So if someone has already ordered 4 tests as of September, October, when they first open up the window, you can go back in and order another 4 free tests for your household. So we encourage everyone to ensure that you have stocked up on your own at-home test kit. It's important that you understand also that the expiration date that you see on the label of your test kit may not be the actual expiration date. So there is a website that you can go to find out if your test has been extended. If your test has not been extended, we encourage you to just go ahead and throw those tests away and get new tests. All of the tests that we have sent out from the warehouse and all of the tests that the federal government is sending via mail order have been extended. So there is extended dating for all of those tests. We like to draw your attention also to test to treat locations. You may remember about 2 years ago, we started talking about test to treat locations. These are your one-stop shop where you can go get tested, evaluated, and treated in one location. These are still available. The majority of them are still CVS stores with a Minute Clinic. However, there are some community pharmacies that are independent chains, urgent care centers, and some local health departments that are still in the business of test to treat. Again, there is another site finder, a map that you can type in a zip code, and it will list all of the locations within that zip code where a patient can go and get tested, evaluated, and treated in that one location. So this is something that we will continue to keep our website updated for as long as there are test to treat locations and for as long as there are CAP locations where people can pick up free tests. The federal government also stood up a free telehealth program. I do not know how long this telehealth program will last, but I anticipate it will continue through at least March of 2024. They usually want to get us at least through the winter. So this is a site where people can register, whether they're sick or not. You can go ahead and register for access to free virtual care and treatment. So through this website, someone is able to access a healthcare provider who will be able to evaluate that individual. You will also need to already have a test kit available. So that way, if you test positive, this is somewhere that someone could log in, be evaluated, and they can either have the medication sent to you or call it in to a local pharmacy where you can pick the medication up. So you can sign up for this free virtual care and treatment anytime, whether you're sick or not. So this is something that patients can do proactively, so they already are in the system, and treatment will be prescribed if those individuals are eligible for treatment. So now I want to do a little bit of an overview of the treatments that are available. There are 2 oral antiviral treatments. They are both now FDA approved, and they are still available at no cost to patients who are eligible. And we're going to talk about what the eligibility looks like in the patient assistance programs as well. But I want to let you know that the first drug is Paxlovid. I have a picture of that in top left-hand corner. Paxlovid is the first-line therapy for oral antivirals for the treatment of COVID-19. But there are a lot of significant side effects if someone is on a lot of other therapies. If Paxlovid is not the drug of choice for you or for anyone that you are around, your family members that are on multiple other medications because of other ailments they may have, then molnupiravir is the only other oral antiviral for the treatment of COVID-19. Both of these therapies are most effective and will only be prescribed to individuals who are within their first 5 days of symptoms. So it's very important that people understand that as soon as they feel sick, you want to have those tests available so that you know whether or not you're positive and you know whether or not you need to have access to medications, because after that 5-day window, these drugs are not effective. And the risk of hospitalization or just getting sicker and having long COVID increases if you are not able to access medication therapy. And so who is considered high risk? We've done several presentations about who is high risk, and I want to make sure that we do go over that again. It is people who are older than the age of 50, unvaccinated individuals, people with underlying health conditions, in particularly individuals who are immunocompromised, so HIV, AIDS, taking medications that decreases the immune system, such as chemotherapy or any autoimmune diseases. All of that would make someone immunocompromised. Someone has heart disease, that includes high blood pressure, asthma, as well as diabetes type 1 and type 2. Those are some of the high risk health conditions, but there are more. And so we will point you to the CDC website. On the right-hand side is My COVID Plan. If you are not familiar with My COVID Plan, it is a one-page document that helps individuals understand what the symptoms are and also identify important dates. It's important that someone knows what date they tested positive, because again, that helps inform around how long you need to isolate, how long you need to wear a mask, who you need to notify. It also helps individuals understand what the symptoms are and when they first started having symptoms, because you want to get those medications. If you choose to go the medication route, you want to have that within the first 5 days of symptoms. And also, if you were exposed, so if someone were to call and say that they tested positive for COVID and you were exposed, you want to get tested at least 5 days after the exposure. So I like to think of it as the rule of fives. You want to get tested and treated within the first 5 days of symptoms. If you test positive, you need to isolate at home for 5 days, ideally, and wear a mask. And then if you were exposed, you wait 5 days to test, and then you start this whole journey if you have symptoms, looking for medication. So let's talk about medication. Both of the oral antivirals became commercial on November 1st. And what I mean by commercial, it means that now the federal government is no longer distributing these medications to local pharmacies for the purposes of giving out free medication. We still have a lot of free therapy that exists in local pharmacies that can still be accessed by patients. However, at this point now, this is where we switch into a copay assistance program as well as a patient assistance program. So for Paxlovid specifically, that is our first line therapy, Pfizer has partnered to create a program that is called Paxis. It ensures that people who are under or uninsured have access to Paxlovid regardless of their financial standing. So with the copay assistance program, this one began on November 1st. This is for commercially insured patients. So these are patients that already have insurance, maybe private pay insurance, insurance through their job, so on and so forth. You can get a copay card, and you're able to register for this copay card right now. And it covers the cost of the medication. So an individual will get Paxlovid prescribed through their healthcare provider. It goes to the pharmacy. There is a copay. We don't know what that copay is. It would be identified by their private insurance. And with this copay card, it would cover the cost of that copay for the individual. So everyone essentially has access to Paxlovid free of charge through December 31st of 2024. So it's through the end of next year. This copay card can only be used one time, and it is tied to you as a specific patient. So one person, if you want to use the copay card, you have to actually log in and register for the copay card, or a healthcare provider or a caregiver. Someone registers for the copay assistance program, you get a copay card, and you can use it one time between now and December 31st of 2024. For all other patients who do not have private insurance, this would be patients who are uninsured or on a government-sponsored insurance plans such as Medicare, Medicaid, TRICARE, or the VA Community Care Network, this patient assistance program provides a voucher for free Paxlovid filled at any local pharmacy or overnight mail order. So what we want to point out here with this patient assistance program is that the pharmacies themselves, though, have to contract to participate in the patient assistance programs. Not all pharmacies are contracted yet, but you don't have to worry about that. There is plenty of free medication that is still available out in the marketplace currently, but we don't know how long that will last. And so when that is depleted, then this is where people will need to turn to the patient assistance program. We are educating providers around this process. We have a call tonight with pharmacists to alert them of this new process for ensuring that patients still have access to Paxlovid therapy. So these are all the people that can enroll in the patient prescribed Paxlovid program. It only takes about 5 minutes to enroll. So the patient themselves can enroll, a caregiver can enroll, a healthcare provider, as well as a pharmacist. So if someone were to show up to a pharmacy, say they show up to somewhere and they want to go to a test to treat location where they can get tested, treated, and evaluated in the same location, the pharmacist can enroll them into Paxis, and they will still be able to participate in the patient assistance program or the copay program as well. And it only takes about 5 minutes to do so. But you, as a patient or caregiver for a loved one, can go ahead and enroll now and get that copay assistance card. And last but not least, we have Lagavrio. Lagavrio is that other oral antiviral therapy. They also have a patient assistance program, but their patient assistance program is a little different. There are some conditions for eligibility, and all three of these requirements must be true. So a patient has to be a U.S. resident and have a prescription from a licensed healthcare provider in the United States. They cannot have any insurance or any coverage for prescription medications, and then they have household income requirements as well. For more information about the Lagavrio patient assistance program, we do have the website listed here as well. All right, so that is the end of the presentation. I am happy to do a walkthrough of the website if you all think that might be helpful, but otherwise, I will pause here for any questions that people may have.
Thank you, Laquoia. There were some questions in the chat about the eligibility, if all these resources were available in Spanish.
Yes, so we have on the website, our website is translated into Spanish as well. So all of the information that I've just shared, you can find it on the website. You would just click Spanish version.
Wonderful. Do we have questions from the group?
Hi, thank you. I think doing a walk through the website that Laquoia, that Dr. Laquoia suggested, if it's possible for you to show it, I think it would be great.
I can do that. Let me pull it up. Hold on 1 second. All right, so I am on the main page of the North Carolina Department of Health and Human Services COVID-19 response. So if you go here, I'm going to focus on testing and treatment because that is what I do. So all of these tabs here are pretty much the information that I have shared with you here. So if we go here to testing and treatment, if you click this button right here, it changes it into Spanish for you. Okay. All right. So I'm going to change it back into English for myself just right now. All right. But then I will change it back for you as we go along. All right. So here down here is like COVID-19 testing right here. And so if you want to get free tests, it has here, get free home tests. And then we have how to check expiration dates for home tests. So if I click this get free home test here, this is where you can just pop your zip code in here. So I'm just going to pick a random zip code near Winston-Salem where I am. And when I click go, a map shows up for me. And all of the locations where there are free tests are located here. There's always a button right here that says version in Spanish. So I'll just click that version in Spanish. And that same information is here. And it tells you where you can go and find those tests. It gives you the hours of operation as well. Okay, so that's how you find free tests. All right. And let's go back to treatment. So if you click here, it says find COVID-19 treatment. Again, it's right now it has a Greensboro zip code in there, but I can type in again my Winston-Salem zip code here. All right. And it tells you all the locations that have, and it tells you what medications they have. So this one has molnupiravir and Paxlovid. This is at a Walgreens store. If I click here, it'll tell me all the places that are actual test to treat. So these are the places, if it has test to treat, that means you can go and get tested, treated, and evaluated in that same location. So that's what all of these stores are. And you'll see most of them are CVS stores. So if there is a Minute Clinic, you can still go and get that. If you can still go to get that whole testing and treatment for free. I was told that I think Walmart is charging $50 for it, but they are participating as test to treat, but it is a charge for it now. Now, what we will continue to keep available on this website, this will only be free medications on this website. So everything that you see here, as long as you see drugs here, this means that this is access to free medications that the US government has already purchased and has already been shipped out to these stores. So as long as you are looking on this particular map, this is where you can always find free drug. Okay. What else? So again, you can always click here and you get all of that same information in Spanish. And let me see, the last thing I want to show you is how to order free tests. Let's go here where it says get free tests, free home tests. If you go here, this is where you can get free tests mailed to you. So if you click on this here, covidtest.gov, it takes you to the website where you can just order your free at-home tests from the US Postal Service. They're the ones that are sending them out. And my screen is just spinning right now, but you will be able to enter, here you go. So you will enter all of your information and they will ship them directly to you. It's important to highlight again, they're doing the exact same things. The test may show an expired date on the box, but the FDA has extended those dates. So you can click here, and we encourage everyone to go to this site on a regular basis. If you have a supply of test kits, to find your test that you have. I know a lot of people have, I know I have quite a few of these. You can go here and you can find out if your test is extended. So you'll have to read the back of the box, but the back of the box will have a lot number, and it will also have an expiration date. This is the date that is printed on the box, and this is the new date that it expires. Okay. Any questions about anything that I've just shared here?